We know that Saskatchewan and our neighbors in Alberta have some of the lowest COVID-19 vaccination rates in Canada. Vaccine hesitancy is a big part of that issue, and some researchers at the University of Calgary are hoping to help. They've built a free vaccine hesitancy guide intended for healthcare workers in Canada. The principal investigator on the project is Myles Leslie, and he joins me now from Calgary. Thanks for being here.
My pleasure. Thanks for having me.
So who came up with the idea for the guide and what went into it?
A small group of us on the team sat on the 3rd of January. How many years ago was that? Oh, not even a year ago. We sat together and looked at what was happening at that point. And I don't know if anybody can cast their mind back, but they were thinking, wow, the first vaccines are going to start coming out soon. I bet you there's going to be people that don't think this is a great idea for a bunch of different reasons. And that's where it started. We said, I wonder what those bunch of different reasons are. There's some literature in the psychology field that suggests there's a bunch of things that people bring to hesitating about vaccines, generally. And so we thought, I think we should check in with people who are going to see a lot of this and see if there's a way we can help them have better conversations about this. So we built the guide on the idea that there's probably not just one, but a whole bunch of different types of hesitancy out there, and that family doctors are going to see these. They're going to be able to identify them, tell us whether it's anything like what the psychology literature says it's like, and then say, here's the stuff that's working to have a better conversation about vaccines with these different kinds of folks and their different kinds of hesitancies.
In research, there's always something that surprises you one way or another. Was there something that really surprised you as you studied vaccine hesitancy?
I sort of talked about this before. The most important part of having a good conversation about vaccine hesitancy is that you completely change your objectives. When I started the research, when our team went into the field, we really thought that one of the most important things you could do was just close the deal as fast as possible. To me, at that point here in Alberta, we were not yet offering vaccines through family doctors' clinics. And I thought, oh, this is a huge lost opportunity, because as soon as somebody says even maybe, you should just be right there with the needle and get it straight into them. And I talked to one of the world experts in this field. This is a professor of medicine out in Quebec, in Sherbrooke, Arnaud Gagneur. And Arnaud listened to me and go on about how, yeah, I think it's really important that we have that vaccine available immediately and really close the deal as fast as we can. And he said, you don't understand how this works. This idea of closing the deal, of stick handling, of getting people to do something, that's going to fail. You have to respect who they are and where they're coming from. And you adjust your expectations for the conversation, not to, wow, this is when I'm going to win, and because they're going to go off and do this, to, I hope we can have a better and longer conversation about this. I hope I can understand you a bit better. And maybe that'll get you to think about it more differently. And maybe that'll get you to eventually go. But my goal when I start this conversation is not, oh, I'm going to get this. I'm going to win this one. And that for me was quite surprising, because I think we all kind of come from that sales culture of like, well, let's get this one in the bag and move on. And that's not the objective that people bring to doing this when they're really successful at it. They go, I want to be your ally. I want to have a better conversation with you, and we'll see where this goes.
I've looked at the guide. It is really well organized, user-friendly. Tell me about the intended user and how it works.
The aim here is to get this into the hands of family doctors, primary care physicians, and their teams. Although anybody who's finding themselves sort of thrust into the position of doing vaccine counseling, which I think is a lot of healthcare workers, could certainly use it. www.vhguide.ca, available to anybody. There's no passwords. There's nothing keeping anybody out of it. We have no secrets inside it. It's intended for family doctors because they're the ones, as I said at the outset, who have these longer term relationships with people, where folks come to them about a bunch of different medical issues over a long time. And we're assuming that that repeated relationship is one where you can have a better, longer conversation.
Myles, thank you so much for your time and for your work.
Thank you very much for having it.
Myles Leslie is the Associate Director of Research at the School of Public Policy at the University of Calgary. To find the guide, head to vhguide.ca.